morning, everybody. Sorry we're late. I was on a call with the governor just now to get some updates and to exchange some information, and which I assume everybody understands. So I wanted to do a few things today. First, a quick update on testing and the results such as we have it in Greater New Bedford. Then talk a little bit about the things that we're focusing on right now. Today you'll hear from Keith HOVAN, the CEO of South Coast Hospitals Group, as well as DAMON CHAPLIN, the city's Director of Health, along with Michelle Hampman, the Executive Director of the Greater New Bedford United Way. So just by way of update, you've heard, and I won't reiterate the test results statewide in Massachusetts or in Rhode Island. You've heard about that. I want to just focus right now on Greater New Bedford. Right now, and there's a point behind this. Right now, we have in Bristol County 5 confirmed cases. In Greater New Bedford, that is New Bedford and the contiguous suburbs, there has been 1 confirmed case of an individual who resides in Freetown. There are 2 people from the city who are under self-quarantine, and which right now might lead people to believe that the coast is clear here. And I really want to emphasize that these numbers are going to change very rapidly. First, because tests have become more available. The very restrictive testing criteria that have been imposed by the CDC to effectively ration the test kits is now being lifted. The testing is now rapidly ramping up, and we'll see more positive hits, more confirmed cases as a result of that. And we'll see more positive tests because there'll be more people who get it. The transmission will increase, and as we've seen in Italy and other countries, that the rate of transmission can pass at an exponential rate. And I think sometimes it's hard. People should think back about their middle school and high school math lessons in this respect. Exponential growth is deceptive early and then overwhelming later on, potentially. When things double at continual intervals, it can add up really, really fast. And so we've seen that play out in Italy. In a matter of roughly 3 weeks, you had a country where there had been just a handful of cases, and then by the end of that 3-week period, they were a modern Western country that was almost completely shut down, as it remains today. Obituaries going in major cities from a half a page to 10 pages. This is serious stuff. And what you're witnessing now, I would submit to everybody, is here in the United States, a collective response to a national threat, the likes of which we haven't seen since the Second World War. This involves everybody at every level of government, every private citizen, everybody, every American. We've got to deal with this. We've got to work together in order, frankly, to save lives. This is not easy stuff. And what we need to know is that these small measures, seemingly small, mundane measures of keeping your distance, as we're doing here, as frankly all of you are doing here, practicing good hygiene, appropriate hygiene, and making the sacrifices that we've seen across the board, whether it's in shutting down businesses or other measures to promote social distancing, is absolutely necessary. And it's not going to be short term; it will be long term. The stuff we're doing now will work, but it's going to work for a period. There are risks down the line of not just a surge, but another surge if we relent on these efforts too soon. So my message to everybody is that we need a change in habits and a change in practices, and it has to be internalized in a big way in order to be effective, not just here, obviously, in New Bedford, but everywhere. So let me tell you what I want to do today is to talk about what we're doing in city government. And I want to just again, and I want to turn it over to Keith so that you can understand what our leading healthcare provider in the region is doing to prepare, which is a hugely important matter, and then to talk again about what's expected of everybody in a little more detail. So here in city government, we have 5 areas of focus. The first is to protect our vulnerable populations, the elderly, and those with compromised immune systems, and that effort's headed up by our health director, DAMON, CHAPLIN. This effort really is focusing on, among other things, on our senior living facilities, our long-term care centers, our nursing homes. These are places where there are vulnerable populations living, to state the obvious, and we don't need any more proof than to look at what happened in Kirkland, Washington, when the virus got into the nursing home. It essentially wiped out the place. 25 people died. We don't want that to happen in New Bedford, so we are being more than sticklers about procedures that are necessary to ensure the safety of those folks, whether it's through enforcement, certainly information sharing, but enforcement, and generally open lines of communication. Similarly, obviously not every person who's a senior citizen lives in one of these facilities. Most of our seniors don't. And so they need to be mindful that they should only be going out under the most important of circumstances. If you can't find food, if you don't have food at home, call a relative and have them deliver it. If you don't have that option available, there are Meals on Wheels that is still running, our service that's been in place for a long time. There are other options. They should call community services if they're having trouble in that way. Secondly, supporting obviously the capacity of the healthcare system to field the challenge. Keith will come on up in a moment to start to talk about that, but all these efforts underway are geared toward ensuring that our healthcare system has the capacity to deal with the inflow of patients. There is, we've heard a lot about the flattening of the curve, and that's all about the healthcare system. If you can slow the transmission of the virus over a long enough period of time, the healthcare system will be in a far better position to be able to make sure that everybody's being treated, that there's testing done, and then ultimately that a vaccine is disseminated, and there's been progress on that front. The third area of focus for city government is on public communication. Again, we're doing these things, and I appreciate everybody's attending today, but we want to continue to push the word out. There's lots of misinformation, as we all know, on social media, and the best way for people to understand how to protect themselves and their families is to receive information from trusted sources, and that's the role that you here in the media play. That's what we do here in municipal government. We want to make sure that you're getting everything you need to know, the collective you, to ensure that that everybody stays safe. So again, the city's website has those sources of information. There are links to, again, other trusted sources like the CDC, the Mass Department of Public Health. The state has set up what is a very effective source of information, and that's a 211 line. You can call 211 and get the state system, and you'll be able to understand, to get to know all the things you need to know about the virus there. But again, the city's website is a good place to start. We're setting up the fourth area as emergency operations. That's headed up by Brian Nobriga, our emergency manager in the city. We will be setting up emergency operations. We're not there yet. Effectively, this is our emergency operations center, as it is in most cities. Most cities are doing it out of their city halls at this point. If there's a reason not to do it there, then it'll be wherever it needs to be. But Brian is working closely with the Massachusetts Emergency Management Agency, MEMA, which recently set up its regional headquarters just down the street here on Purchase Street at the Quest Center, which is very convenient for folks in fortuitous for us here in Greater New Bedford, and so having that close working relationship with the state for emergency operations will be very key. And then the last area, and I do want to offer a little bit of detail about this, is the continuity of operations of city government. So government at every level is downshifting in certain ways, but at the municipal level is distinct in that we provide direct critical services to people in a variety of ways that we're all used to, and sometimes we just take for granted. So that includes the water that comes out of your sink, the water that goes right down your drain. Maintaining those systems is very important. We have plans for that. Obviously, our first responders will play a very key role. Theirs are not jobs that allow for telecommuting. They've got to be out there, and so all of those departments, fire, police, EMS, have plans in place to prioritize emergencies. So in that way, I want everybody to know that, to understand that we really don't want you calling 911 if it's not a real emergency. For starters, if you feel sick, call your primary care physician. Don't go to the emergency room. We want to keep our first responders upright. They're going to be going in and dealing, especially EMS, they're going to be going in and dealing directly with folks who may be infected. With respect to the rest of city government, many, if not most, of our departments can operate remotely, as we announced earlier this week. Public access, and as you've seen, as people have knocked on the door in the last half hour, we're restricting public access to city facilities entirely this week. I've gotten from all of our 30 some odd departments essential service plans that include the degree to which they can operate remotely, and just about all of them can. It's not easy, it's not perfect. We're in the people business and city government, but for the foreseeable future, many of our departments will be operating remotely. We'll have more detail about that to announce on Friday. There are certain things that still require public access, and so again, by Friday we'll be able to be clear about how people can pay their bills, how people can apply for things they need to apply for. Again, a lot of it can be done online. We have many folks, as many learned yesterday, who have paid their bills in cash or who come right straight to City Hall to drop off a payment. Again, we emphasize that you should avail yourselves of online payment, of phone payment. We're going to be waiving, as we announced yesterday, we're waiving the convenience fees associated with credit card transactions to the extent that this week we are closed to public access. Those days in which we're closed to public access entirely will not be counted in the calculation of late fees, so we shouldn't worry about that. We really want people to get in the mode of doing things online. One other thing that we are announcing today, and this one, frankly, is a drag, but I think it is done out of medical necessity. We are going to be closing down the city's playgrounds, so you're going to see yellow tape around swing sets and jungle gyms and the like, which really stinks. The city has great playgrounds, many of them newly built, but the reality is that the virus can live on surfaces for some period of time, and we don't want kids, students who are out of class for the time being to be using them in earnest. It's not safe for them, it's not safe for their loved ones that they do that. So unfortunately, we're going to be doing that and enforcing that. And I hope everybody understands, especially our parents who want to get their kids out of the house. I want to just mention a couple of other things before I call Keith up. I really want to thank the businesses in our city. A number of them have made sacrifices without being prompted by government action. So, for instance, two of our largest manufacturers, the Acushnet Company, the maker of the world's famous Titleist golf balls, along with the Joseph Abboud and Suit Factory, both shut down for the time being, for different lengths of time. But those are two places that together employ almost 2,000 people, and that's a real sacrifice on their part. The bars and restaurants you've seen, they are taking it on the chin right now. We want to make sure that people are still ordering takeout. You've seen me on social media eating takeout and getting delivery. You probably made conclusions about my caloric intake. But I want everybody to know this is a good thing. Many of them are going to have to be letting employees go as a result of this, and more generally, we're going to see in the city, and there shouldn't be any, and nationally as well, we're going to be seeing layoffs at some point, and so we're dealing with the state and the federal government to make sure that unemployment insurance is made available to everybody, that those benefits are extended, because there are a lot of people who are suffering more than others. So again, it's really a point that we should be supporting one another throughout this effort. Just want to mention with schools, we've had a really good start to the distribution of food at our schools, especially for students who receive free lunch at the New Bedford Public Schools, because our surrounding communities don't have those distribution networks up yet. We want to make sure that students in all of Greater New Bedford, not just in New Bedford Public Schools, but all of the schools in the area, know that you can get meals at the designated distribution points, which are all listed on the cities as well as the school department's website. So we want kids to be fed. We also want there to be meaningful learning opportunities for all of the students. And so pay attention. If you're out there, pay attention. You've got homework to do, kids, and you've got time to do it. So make the most of the opportunity. It's not summer vacation. We want to keep students engaged. This is not a perfect way to educate students, but it's necessary under the circumstances. With all that, and again, the reminders around a couple of other things. While you have time, I say this not just to kids, but everybody, every family member. One activity that the city would encourage you to do is fill out your census form. The census is still going on. The census, the decennial census in the United States, is one of the many things that's being severely disrupted right now. But you're getting these things in the mail. You can go online, make that happen. It's important for the city to do that nevertheless, and we have a little more time to do that. There are a number of other things to talk about, but we want people to practice good social distancing. We want people to spread the word about good hygiene. Washing your hands, think about your hands, what you're doing with them, when you're washing them, and what you're touching. All very important to keep in mind. You'll continue to hear that again and again because it is so important. With all that, I wanted to ask Keith HOVAN to come on up and explain what our leading healthcare provider in the region is doing to ensure that they are ready, and then again about important practices we should all be engaging in to ensure the safety of all of our residents throughout the area. Keith.
Thank you, John. Good morning, everybody. Thank you. It's great to be with you here this morning. These are truly extraordinary times, and extraordinary times call for exceptional cooperation. So I want to first let you know that we are working very closely with our first responders in fire, EMS, and police. We are working very closely with our local, state, and federal government officials who have been exemplary in their cooperation and in their assistance being provided to all of us as healthcare providers. So as the largest provider of healthcare services in southeastern Massachusetts, with our 3 hospitals, our VNA, our very large multi-specialty physician group, we have a responsibility to be ready for the community when the community needs us. As part of that, we have been undergoing assessments of our resources and augmenting those resources so that if and when a surge comes, we will be ready. That includes looking at our manpower, our nurses, our advanced practice professionals, physician's assistants, nurse practitioners, and our physicians. And we're making sure that we have the appropriate people in place to be able to respond when that response becomes necessary. We've reached out to physicians and are reaching out to physicians still who might have recently retired from our organization or from the practice of medicine. And as you might have heard from the governor's declaration, those physicians who are in good standing, can come back and have their licenses reactivated. We want to bring those people into reserve and have them ready for when we need them. We also need to protect our patients. And what we've started to do, and it became effective just this week, is we have restricted visitation for inpatients in our hospital. So adult inpatients cannot have visitors right now. We're trying to protect our patients, protect our staff, and the best thing for us to do is limit the ability of people to come in and out of our facilities. So what you'll see is for those patients who have an end-of-life care challenge, we'll make exceptions. For those patients who are coming in to deliver a baby, we certainly want partners to be with their significant others as they're delivering their newborns. And we certainly want children to have access to their parents. So there are some exceptions, but most of our visitation has been severely limited for the purpose of keeping people safe. The other thing that we're switching to is the process by which we see our outpatients. Most people who have doctor's office visits that are not time sensitive will have those visits deferred for the time being. Those people who need to be able to speak to a doctor about something acutely or routinely as a follow-up item will have that visit conducted by telehealth. So we have stood up our telehealth platform. We've been providing telehealth visits for some time now, but now we've brought those functions into the system of care, and we will routinely be offering telehealth visits for all of our patients. We've tested our systems; they seem to be working really well, and they will keep our doctors and our APPs connected to their patients. For those patients who need to see a doctor or whose physicians determine that they need to come in, we will have specific locations available for those patients when they need the care so that they get what they need and we can keep them at their optimum state of health. So we've started to address the human resource needs, which is in part what I just addressed, but we've also are in the process of addressing our facility and infrastructure needs. So we have stopped performing routine elective procedures so that we could create capacity in our hospitals, in our intensive care units, on our inpatient units. So when patients need us, we'll be able to be there for them. We have assessed the items that we need for critical care. You've heard probably from the Italian experience that there were concerns about having adequate supplies of ventilators and things that help support the safety of those getting care and services in our ICUs. We have had the good fortune this year of upgrading our ventilator fleet to newer ventilators, and we had the foresight to not turn in our old ventilators. So we have an abundant supply for the time being of those devices and those items that we need to create an environment that is going to be safe for patients. Here in New Bedford at our St. Luke's campus, we're actually in the process of just finalizing the construction, completing the construction of a brand new intensive care unit that will add 16 additional beds of capacity to the region. As we're not performing elective surgeries, we have our ambulatory surgery centers and our post-anesthesia care units that will be available with monitors and nursing staff to help support patients and deliver care. So we're ramping up, we're preparing ourselves for what might come, but we want to make sure that what we're doing most importantly is keeping people out of the hospital for the time being who don't need to be there. So before you come to an emergency department, call your provider, share your symptoms, share your concerns with your provider. Most of the patients that we're seeing, and I'll invite Dr. Hackner up in a moment to comment on this, most of the patients that we're seeing can be managed at home, and you've heard that over and over again. The majority of patients are going to have flu-like symptoms that can be managed in the comfort of their home. They don't need to be in the inpatient setting. We want to reserve our emergency departments. We want to reserve our inpatient units and our ICUs for the people who might need them most as this process progresses. One note of encouragement to everybody: use credible sources of information as you seek to educate yourselves about this process. Don't rely on what your friends and neighbors might have heard. Go to CDC, go to mass.gov, go to southcoast.org, go somewhere where you're going to be able to get credible information about what to do, when to do it, and how to keep you and your family safe. Getting information from your financial advisor or your best friend down the street may not be the best source of information. So what I'd like to do is just take a moment to invite Dr. Dan HACKNER. Dan is our Chief Clinical Officer for South Coast Health, and Dan will address what we're seeing and what we're advising as it relates to things like testing.
Thank you, Keith. Thank you very much, Keith, and thank you for taking this challenge so seriously. I can't emphasize how seriously South Coast and its clinical staff take this situation, how seriously we take the situation. Our incident command has been up now 3 weeks. We're meeting multiple times a day, addressing the kinds of issues that Keith outlined: resource allocation, protective gear, PPE for staff, triage and screening of patients, and clinical pathways and workflows. We stood up quite early, first looking at what we had done to screen for measles, another infectious disease that we saw in the community a year ago, and there were some near misses. Though they didn't affect South Coast, we redid our screening processes based on the measles outbreak. And then as COVID emerged in January, we looked at what was the best information on screening and triaging patients, and then built new workflows. And again, to Keith's point, based on the CDC and Mass DPH and Rhode Island Department of Health recommendations. And it's important to note that these are evolving. So every day, our day begins with checking what's new on those websites. And I recommend everyone become familiar with the information on those sites. It's readable for patients. It's readable for providers. They're kept up to date. And it's your responsibility to empower yourself at this time, just as our healthcare givers, our providers, are using that information to drive change in our system. So Keith talked about some of the operational changes. Clinically, what has that meant for us? It means that we have very active measures to make sure that healthy and patients who are healed no longer need to stay in the acute setting. Secondly, for those who do need care, we do not want delays. Folks who are having lower respiratory tract symptoms, symptoms of pneumonia, we want those folks to be seen timely, in the right place, and with appropriate protection to our staff. In rounding with the staff this morning and this week, folks are concerned appropriately, but there's a wonderful spirit of dedication, of community service at South Coast. We're owned by the community. We're here to serve the community. We take it very seriously, and we expect, with new testing capability and broader criteria, that we will see new cases, we will see more testing, and that is needed at this time in order to flatten the curve. So we've set up 24/7 clinical hotlines for our providers and clinicians. We've also established communications with patients, including electronic communications through our integrated electronic health system. We've triaged patients to areas where we have concentrations of testing supplies. And for patients who don't need to be tested at this time, we've reassured and stayed in touch and set up a system to track both those who need testing and those who may not need testing at this time but may need follow-up. There's a lot of detail that goes behind all of this work. There's a lot of credit to go to Keith and Renee Clark and the Chief Operating Officer and Elizabeth Smith, our President of the Medical Group, but it doesn't stop there. We've reached out to our partner groups and organizations in the community, including the municipalities, and our algorithms, our workflows are being shared with other organizations as they share with us. There's a lot of work that needs to be done, but South Coast is stepping up, and the staff are appropriately concerned, but showing a very strong spirit in this fight. I will emphasize, as Keith has, as the mayor has, that individuals should be very much mindful of good hygiene. You don't need alcohol-based sanitizers if they're in short supply. Soap and water works best. Lifts up those proteins and viruses off your skin and reduces the burden of disease, of flu, of COVID-19, and other viruses we're seeing at this time of the year. Secondly, social distancing is effective. The virus spreads by droplets about 6 feet. Maintaining 6 or more feet distance for an elderly or at-risk individual is helpful. We do encourage use of masks for providers and patients in the inpatient setting when you're sick with a respiratory condition. We don't recommend using them out on the street in general use. They become wet and ineffective. They pick up organisms as you put them down, and you use up important resources that you may need later as a patient or a family member or a caregiver. So we really encourage folks to do things that are protective around hygiene, but use of masks, walking around, may not be something that's helpful to you, might actually put you at risk. But at this time, folks are worried and folks are appropriately nervous. And our job is to communicate with you regularly, to communicate with our staff regularly, and to really plan, to do the work that needs to be done to make you safe. And I'm very confident that our staff, our clinical leaders, take this very seriously. We know it's not going to be easy, but we can make a difference, as you can, in providing good communication and emphasizing strong hygiene at this time.
Thanks, Dan. Thank you, Dan. Thank you, Keith. And thank you for, more than anything else, operating with the sense of urgency that's necessary under the circumstances. It's really comforting to know that South Coast is doing everything it can to protect the lives of everyone throughout southeastern Massachusetts. One of the mechanisms that Dan mentioned, the communication with municipal government, among the measures that we have in place is a standing 9 o'clock call that with the provider community, along with municipal government and a number of other folks, a standing call at 9 a.m. every morning. That's headed up by our Director of Health, DAMON CHAPLIN. I asked DAMON to come on up and tell us a little bit about the efforts around the protection of vulnerable populations. DAMON.
Thank you, Mayor. I think it's important that we share with the public the health department's role in addressing this epidemic. As the COVID-19 outbreak increases its spread of transmission throughout communities, it's important that the health department stands up and supports the community by identifying the level of community transmission within the city, understanding the community's characteristics which create vulnerabilities within the city, and supporting healthcare capacity and enhancing public health capacity as well. The mayor's gone over some of the numbers for the area, for the region. We have 218 total confirmed cases in Massachusetts, 5 confirmed cases in Bristol County, no confirmed cases in New Bedford as of yet. Again, we're all working very hard to prepare for this surge that may be coming to our area. The testing capacities have expanded. As of Tuesday morning, the state public health laboratories have conducted roughly about 1,300 tests with new clinical changes from the CDC. The state lab capacity to test for 400 patients per day, up from 200. National testing laboratories continue to ramp up their testing capabilities as well. As of yesterday morning, the state lab received reports from Quest Diagnostics and LabCorp that they completed an additional 384 tests. As the mayor spoke about our vulnerable populations, our most vulnerable population is those that are in long-term care facilities and our seniors. And so we're taking very strong measures to protect them. We are enforcing the orders from the state that those long-term care facilities do not have any senior visitations. We're going one step further for those other facilities that have our seniors there. We're asking them to cooperate with the state's orders. We are redirecting our staff at the health department to go by these facilities on a regular basis to ensure that there are steps in place to monitor visitation at these locations. In addition, we are also visiting our establishments where there's no food consumption or gatherings over 25, those food establishments, bars and restaurants. We are being diligent about that. We've delivered notifications to all those facilities over the last couple of days, and we will continue to monitor them over time. And so please know that we will be checking, and we ask that the restaurant owners and the business owners, as they have been, to cooperate with us during this time. This is really important time in this disease process that we try to prepare the community for what may or may not be a surge that we haven't seen before. In addition to that, we're asking our workforce places, if you have staff, large numbers of staff, we're asking that you implement some continuity of operations, which allows them to work from home or remotely if possible. Again, following the lead from our governor and our mayor to try to enhance social distancing as best as possible to kind of mitigate the effects of this disease. In supporting our healthcare facilities, we're working closely with the hospitals and healthcare systems to respond to these challenges. We're updating our contingency plans to complement the healthcare strategies. We are asking that all stay informed with the most up-to-date information. As Dr. HACKNER had just informed you, one city, one message, one strategy. And we ask that you all either go to the CDC, the state website, or our website at the city's website for the health department to get your information. We provide administrative community-level support to patients and providers. We help to coordinate and contract tracing for confirmed cases, and we help to coordinate volunteer support. And so you'll see these efforts roll out over the next several weeks, several days and weeks, in an effort to support the things that are happening behind the scenes. And then enhancing our own public health capacity, our public health workforce and availability of resources to implement strategies. We are, again, reorganizing the way that we do our work. We're re-emphasizing some of our day-to-day activities so that we can focus on our most vulnerable populations. We're in conversations with the hospitals and other organizations to reach those hard-to-reach communities like our substance abuse or mental health populations, and also our immunocompromised populations as well. And so we're discussing strategies to get to them, to reach them, to survey them, and to provide services to them. And lastly, we just ask that you, above all, you be a part of this solution by following the orders and recommendations coming from the state and local government, the mayor and the governor. Protect yourselves and your kids. Please, please, please wash your hands after touching surfaces. If you have sanitizer, use it. Practice social distancing. These strategies have worked, and they will work for us in helping us to maintain and keep this disease at bay. And lastly, communication. We will be getting the word out to the community through several different venues on these particular strategies that we're using over the next several days. So please, please, please stay tuned and work with us. Thank you.
All right, thank you, DAMON. So being part of the solution, being part of the effort, again, is something that we really want to answer. Everybody can play their part, again, in simple ways, through social distancing, through good hygiene, but there are other ways that you can help. A lot of folks have written me or asked over the radio or through other means of communication how they can pitch in, and there are a number of ways. The focus for a lot of comments has been about, like, well, what can we do with the school system? I just want to commend Superintendent Thomas Anderson's efforts and that of his team to get learning back up and running and get food distribution up and running very, very quickly. Parents can play a big role in facilitating their child's learning as they sit at home for at a minimum of 3 weeks, and it may be longer than that. There are other ways to give, other ways to support and contribute, and I wanted to call up Michelle Hampman, the Executive Director of the United Way of Greater New Bedford, to talk about one mechanism that the United Way has set up that will allow folks to contribute in a number of ways. Michelle.
Good morning, everyone. Before I get to how we are hoping to engage the public and mobilize people to contribute and help, I do want to emphasize that Governor Baker did declare 211 as the official COVID-19 hotline to answer questions about COVID-19 prevention, symptoms, and treatment, information about testing, guidance for people that are planning or returning travel. If people utilize the 211 number, it will really alleviate the stress that all of these people behind me are trying to manage in fielding the calls at their various departments and healthcare facilities. 211 is available in 140 languages, and it is available free, confidential, and 24/7. As you can imagine, the call volume has increased exponentially, so we are obviously asking people to be patient. However, it is truly a great resource for people to utilize in times like this, and it's a service that we at the United Way of Greater New Bedford are proud to support and fund. It is a partnership with the Commonwealth of Massachusetts and the United Ways in Massachusetts. Our United Way, in addition to continuing to provide our direct services through our Hunger Commission and other programs, is also collaborating with funders and institutions to assess needs and coordinate efforts to support our nonprofit partners, providing crucial safety net services, resources, and communications that will allow a more timely and effective response and a coordinated distribution of funding. I am proud to announce that our board and our organization has established the Help United Greater New Bedford COVID-19 Response Fund. This will help working families and organizations in times of crisis. This fund will provide a flexible source of cash assistance to those being affected the most. Right now, we are especially focused on how to best support service people who have been immediately impacted by closures and social distancing regulations. A process for applying for and receiving these funds will be communicated later this week, but first we need to raise the funds, and that's where I call all of you to support us and use your media outlets to help us spread the word so we can inspire people to contribute to this cause, and then we will be hopefully deploying those resources to the people that need it as efficiently and as quickly as we can. There are going to be ways to contribute, and all of this information will be shared with the various media outlets. Right now, there is information on our website, and people can already begin to give by texting Help United to the number 313-131. People can also make donations right on our website. But it's our hope that all of you will do your part to help us spread this message and engage the greater public. Thank you so much.
Thank you, Michelle. So just to repeat, text Help United to 313-131. Easy to remember. That's the way to contribute. We really want to raise the funds available to a lot of families who are going to take it on the chin because of job loss or other complications while we get through the overall challenge. I wanted to acknowledge the presence of City Councilor Brian Gomes, who's here today, and thank the City Council for their support. And with all that, I'll open it up to questions. Go ahead, Mike.
Does the city of New Bedford have his testing kits equal to, say, Fall River, Brockton, other kind of cities? Are we under or over?
The kits themselves, or okay, well, I could ask you guys to come on and talk to that.
So at South Coast here in the region, presently we have just under 200 kits. So when you think about a patient population in the South Coast region of over 350,000 people, we only have 200 kits available. So we're using the criterion that have been developed by the state of Massachusetts in the deployment of those kits. And we're actually sending a fair number of folks home without having been tested because they don't meet criterion.
Is there any plan for a drive-through testing site just to collect samples like they have on Cape Cod?
Yes. So the question is drive-through testing. We have plans for drive-through testing, but in order to implement drive-through testing, we have to have enough test kits and media to put those swabs into once we collect them. Our hope is that tomorrow we'll be resupplied and we'll be able to actually open and bring that service live.
Can you elaborate on the Freetown resident who has a confirmed case of COVID? Did that person go through South Coast to get tested?
To the best of my knowledge, we did not treat that patient.
Can you elaborate if it's a man, woman, 40s, 30s?
I don't have any data on the patient.
The data comes from the state, and it's limited data.
And there are 2 New Bedford residents in quarantine?
Yeah, so that, you want to speak to that? Yeah, so there are 2. I don't think there's anything else we could add to that.
Yeah, that's what we know at the present time, just 2 people.
Have you discussed the possibility of doing a shelter in place?
So if you're asking me about it, so let me just, before we get to that question, Jeanette, I do, on the matter of testing, it is our understanding that the criteria that had been in place and an effectively rationed testing is being lifted as the volume of test kits is now going to be growing. Katie, do you want to speak to that?
Yeah. There's no doubt that we were late to ramp up testing in the U.S. But as we look at the coming weeks, we are looking at a lot of testing coming online. The Department of Health in Massachusetts has increased the throughput of their sample processing. We have vendors, multiple vendors going online with commercial testing. The Department of Health has also expanded to 8 categories. 2 of those are appropriate for commercial testing, are not being done at the Department of Health. And so that, together with the potential for some laboratories to set up local testing, will mean much more availability of testing. And we're in this in-between period where we have to identify and risk stratify patients. We have to take care of ill patients, and some patients who may have upper respiratory symptoms who don't meet criteria may need to self-quarantine at home. It's a difficult period for folks. It is going to be a transitional period as we stand up much more testing capability. But we're confident we're going in the right direction on testing. And we also want folks to understand what more testing means. It means we will discover cases, and that is good because we can then do contact tracing, we can treat, and we can limit the spread of COVID-19.
As far as schools go, I spoke with an elementary school teacher earlier this week who wasn't really sure what the plan was. That was Monday. Have things evolved as far as, actual lesson plans for kids and laptops for kids? What's going on right now?
I'm going to get to Jeanette's question. We just try to do this in an orderly way, and then we'll have the superintendent speak directly to the homework question. So I know a number of municipalities have considered, or at least are discussing right now, sheltering in place orders, which in the most literal sense means everybody's got to stay home, right? And then there are certain, as I understand it, some have made qualified sheltering in place orders which allow for certain folks to go out. I don't think it works really at the municipal level, just because our economies are regional, right? People commute. In our case, people commute into New Bedford and so forth, or commute to other places, as the case may be. And so, I think that can only be done at the statewide level. I will say that a categorical sheltering in place order, even at the state level, is not something I would support, because there are many important exceptions, so many important exceptions, even beyond the healthcare system, that would require people to go out. So, for instance, here in New Bedford, not only America's largest commercial fishing port, but also the largest seafood processing base in the entire country. We are a big source of food for America and beyond. And so, the idea that we could just say, to every fish processing plant or every boat owner, you got to shut down is simply not realistic. So, we're having those discussions now with the state about what may be appropriate if we get to that point. But, a categorical order is not something here in the city that we're considering. Do you want to talk about schools?
Good morning. So what we had been planning previous to the closing of our schools, we have been working on work packets for our students. So as of right now, so today is Wednesday, as early as yesterday, during the lunch pickup, the lunch and breakfast, the meals pickup, schools were actually distributing work packets to students. So most schools had them available already. We had told everyone we would try to have them available by Thursday. But under principal's leadership, they've been able to produce those materials. What they are, they're based on grade levels, and they are at each of our schools. We can tell our parents to make contact with the school. You can go there and pick them up. In addition, we already had teachers as early as yesterday doing Facebook Live lessons, reading online, and doing all those type of things with our schools. So we did have a lot of individuals that jumped out there, and we have a great group of teachers that have taken a lot of it unto themselves to make sure they're reaching out to their classrooms. You know, there's Class Dojo, there's some other online platforms that they're able to post assignments and those type of things. We're also working through to make sure that it's an equitable situation, so students that may not have online access, we're working with some of the other community organizations to be able to provide that. But the majority of the assignments, if not all, will be paper pencil. But then thinking of how do we make it more project-based and thinking of the outcomes that we'll have when everyone comes back, and we can use those materials to extend that learning.
Is it too early to consider what's the future of MCAS this year? I mean, it's supposed to be in a few weeks, right?
You know, so MCAS is what it is. I always believed, and I'll say it again, that, you know, a test is not the summation of what our students' ability is. However, it is something that has to be considered. We're still working with there's several conference calls with the Department of Education, with Commissioner Riley, and those are things that they're looking at to see what are the next steps with that. And there was a call yesterday. They haven't made a determination. They are working on that. We don't know yet. So my thing is make sure we're extending our students' learning, being ready with those skills that they need to do well on any type of assessment or any type of other way where they can articulate their thinking. So,
Mayor, is parking being enforced in the city? Meter maids and such?
So some things are and some things are not, right? So we obviously have seen there's not nearly the volume of vehicle activity in the downtown as there ordinarily would be. What we are enforcing, we're not enforcing the meters themselves. We are continuing to enforce the rules around parking in the appropriate place. So if someone's pulled up on the sidewalk, that person's probably going to get a ticket. If the person's at a meter and the meter runs out, they're not going to get a ticket.
Last question.
Great. So I just wanted to thank everybody for for their continued coverage. It's so important to get information out that's accurate, and we're all in this together. Thanks a lot.